So mandates for the kind of indoor air quality that would protect us from COVID, from measles, from influenza, and who knows, the disease X, the next pandemic. Those kinds of mandates do not yet exist. They just don't. We've been through this COVID pandemic. We've learned that the damage that an airborne disease can do. There still are not mandates in place, and part of it is because guess what? It will cost some money. I mean, you save a lot of money on the other end when people aren't getting sick, but there's just this reluctance to say like, okay, what do we do with a school where the windows don't open?
Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart.
Airborne transmission has shaped the course of pandemics, and we ignored it for over a century. Carl Zimmer is the author of 15 books about science. His latest book, Airborne, is a gripping account of the scientists who fought to prove that germs travel through the air. From dismissed experiments and unsung pioneers to the deadly consequences of institutional delays, we discuss how outdated beliefs shaped public health and hindered our response to COVID-19. I hope you enjoy the conversation. This podcast is brought to you by TELUS Smart Home Security. Secure, simplify, and easily monitor your home from anywhere using the Smart Home Security app. Visit TELUS.com/smarthome-security to learn more about Canada's most trusted security provider. Hi, Carl. It's really good to see you.
Thanks for having me.
So your brand new book, you are a busy author. This is your 14th book, is it?
15th.
Oh my gosh, 15th book. Your new book is called Airborne, The Hidden History of the Life We Breathe. Tell me why this was a topic you wanted to cover.
I was working on the coverage of the COVID pandemic at the New York Times with a bunch of colleagues. And we were covering, the new science of this new virus. And, scientists were trying to make sense of it. And there were lots of debates going on. And the one that really hit me the hardest was the question of how COVID spreads. I and other people were, we were washing our groceries and things like that, thinking that it spreads on contaminated surfaces, maybe if someone sneezes in your face. But then there was this group of scientists who were saying, no, it's airborne in the same way that smoke is airborne. That you could spread around in an unventilated room at long distances and get people sick. And that turned out to be right. That's the consensus now. And I was really intrigued that that would be such a subject of debate. It seemed like that would be something you could sort out pretty quickly. And scientists explained to me how this has a deep history. And to understand the nature of this new conflict, you had to really understand all that history of debate and confusion and mystery and so on. And so pretty soon it was deep into this history, but I was also discovering this whole science of aerobiology, the life in the air. And so the fact is that the air, both indoors and outdoors, is full of living things, and they affect the natural world, and they affect us and our health. And so I realized that I had hit on something that could really sustain a couple years of deep research and a book.
I mean, I have a hard time still understanding why people didn't understand that it was airborne. To me, I mean, again, I'm not a scientist, but it just seemed like aren't most colds or aren't most viruses airborne?
Uh, some are and some aren't, and some might be, but the research hasn't been done. Um, it, it's it can be it can be very tricky to figure out exactly how a pathogen spreads. It's not as simple as it might seem. And there are some diseases where it's super clear. Malaria. You're not going to get malaria off your groceries. You're not going to get it shaking hands. You got to be bitten by a particular kind of mosquito that carries a particular kind of protozoans. That's malaria. But these other diseases, influenza and colds and so on, things can be harder to figure out. And how do you prove that something spreads only long distances through the air? Like how do you demonstrate that? Like there are lots of different things you can try. You can try to catch droplets out of the air and see if they have viruses in them. But are those viruses viable, or has the pH, ruined them, and so now they're not infectious? Like, there are lots of questions that go into figuring out airborne transmission. So it's not a simple thing, but historically, public health officials and infectious disease experts really, really did wanted to dismiss it, for over a century. And I think that actually led to a dangerous underestimate of the possibility of airborne infection. Because if something's airborne, that means it can spread very easily. That's why measles right now is so dangerous. It's airborne. It can get from one room to another, and it can find people who are not vaccinated and infect them.
Right. And we know a lot about measles. I mean, we're hearing about measles again in the news with outbreaks, in Canada, in the US, everywhere, really. So that's something we know something about. COVID, we didn't know very much about. I mean, but we knew.
Well, it was a new disease. It was a new disease, but on the other hand, it's a coronavirus, and this was not the first time that we had dealt with a new coronavirus causing a pandemic. So we had SARS, which hit Canada quite hard in 2003, and at the time, people were often trying to treat it as if it was just, short range infection contact. But there's a lot of research that, at the time that was suggesting, no, maybe this is also airborne. But that really didn't get incorporated into how people thought about diseases more generally.
And it's really hard to bring the public in too, right? While you're trying to discover scientists are trying to discover this new, virus, this new disease and in real time. And meanwhile, every country is talking about it in a different way. The World Health Organization, they didn't even really come out and say that it was airborne right away. Why do we have a history of ignoring, I guess, this airborne transmission idea?
The roots of this issue go way back. And in fact, you really have to kind of understand like the whole history of medicine, really. Because if you go all the way back to, say, ancient Greece, you would have doctors like Hippocrates who would talk about diseases in terms of miasmas. What they were talking about was this sort of a mysterious corruption of the air, that somehow the air itself became dangerous, and miasmas would drift along, and if they just passed over a city, people in that city might suddenly get the plague. And in one form or another, miasmas really held sway, particularly in Western thought, until the 1800s, really the late 1800s. And it was only then that the germ theory of disease emerged, and really, like, the evidence really locked in to show that, cholera, for example, it's not a miasma, some mysterious thing that's drifting along in the air, but it's a particular species of bacteria, and that is transmitted in contaminated water. That's it. So if you, like, make sure people's water supply is disinfected and safe from this particular bacteria, they will not get cholera. Sadly, we're still dealing with cholera outbreaks today, but like we know how to deal with them. It's just, do we have the will to deal with them? But there you have a waterborne disease. And so all these diseases, one by one, I mentioned malaria and so on, they all got kind of pulled out of the air in the late 1800s and early 1900s. It was really fast. And it was so fast that basically experts were left thinking, well, okay, if microbes cause diseases and they're all in the water and food and transmitted by sex from mosquitoes, like, what, we don't have to worry about the air. In fact, they didn't believe that germs could travel through the air. And so that then really just led to a sort of a general default assumption that airborne bacteria and viruses were not really a thing.
Right. And it just kind of that carried on for 100 years?
It still carries on. Yeah, absolutely. Absolutely. No, it still carries on. That is sort of a default idea, because that's, I've talked to people, I talked to Anthony Fauci, who himself has sort of come to recognize the importance of airborne infection through the COVID pandemic. And he's like, look, when we were in medical school, this is what we were taught. And you just sort of assume that the science was all there, and turned out that it wasn't. That it wasn't. And so that's a kind of a refreshing acknowledgement that one has had some out of date ideas, and he's revising his ideas. But historically, people really kind of locked into this view, even when there were a few scientists over the years who were heroically struggling to demonstrate that some diseases are in fact airborne, like tuberculosis, for example.
Mhm. It's interesting because when we think about the humility, I guess, or, the ability to, I don't know, we hold scientists. They're no different than any other job, I guess, where you have to be updating, you have to be right, like, things are changing all the time. But again, once we said we know everything about measles, really. Well, so you think you don't need to learn anything more about measles, but here we are today, and we're finding out that, people aren't vaccinating against measles, and people don't think measles is a big deal because we've forgotten about measles, really, because it doesn't affect us so much anymore.
Well, the science I mean, the science of measles is pretty well established now, including the fact that they're airborne, and that measles vaccinations are highly effective, and so on. If there, the what's happening is that the connection between that science and sort of the public understanding of it, there's a gap, so that people will decide, "Oh, I don't want to get my kid vaccinated because," and then there's these list of reasons. "Oh, measles is good for you. Measles strengthens your immune system." I mean, measles is not good for your immune system. Measles is like a factory reset on your immune system. You can, like, lose your ability to defend against other diseases when you get measles. Measles, you do not want to get measles, and yet there are parents who think that measles is either a neutral thing or a good thing, and it's just not true.
Right, but they aren't scientists, the parents. So there, because we have, scientists talking about airborne, diseases and viruses and how they are spread and all that, and that's it, like, mandatory work. But then there's the whole other part of it where somebody has to take this information and give all that information to the general public. And I think that's where we get into big trouble is we think we know something as the average person. Like, I think I know, oh, I don't know anybody with measles, so it's fine. I don't need to get my kid vaccinated. Yeah, but that's not how it works, right? Because we, as general people, we don't understand that.
Right, and the irony is, the reason that you don't know anybody who had measles is because they all got vaccinated. The reason you don't know anyone with smallpox is because smallpox was eradicated through vaccination. So this idea that I'll go, "This can't be dangerous because I, in my personal own experience, have not encountered it," that's the sort of fallacy of common sense. Like, oh, like, well, based on my own experience, like, the great thing about science is it takes you beyond your own experience.
Exactly. But I think what I'm trying to draw this line of there's this empty space between what scientists know and what the general public or some people refuse to hear, or they don't hear the message, or they don't understand. And don't you find that healthcare in so many ways has been politicized since COVID, right? Like, I find that even here in Canada, right? Like, we have measles outbreaks in lots of provinces. I never thought I'd see a time where people aren't vaccinating against, things like measles and, or, I mean, I have friends whose parents had polio as a child. So we seem to have a short attention span or a short memory as not scientists, as general, consumers, people living their life to think that we're so privileged that we don't have these diseases anymore and we don't need to protect ourselves, right? It's a very confusing, I think it's common sense. You think it's common sense, but it can be really full of fear for so many people.
You know, people can people can develop a fear about, injecting things into their bodies. People can develop lots of different fears. I mean, I think the irony is that people who might develop a fear of vaccines, despite the wealth of evidence that they're safe and effective, will then, in many cases, say like, "Well, I don't need these vaccines. My kids don't need these vaccines because we're healthy, and the reason we're healthy is because we take all these supplements." Supplements that are, at least in the United States, are fairly unregulated. Their claims are not evaluated by the Food and Drug Administration. So somehow vaccines are this incredible danger, and supplements are considered natural or safe. Yeah, which is just
And listen, that's a whole other book. So let's get back to airborne. So if we go back to 2020, it feels like an absolute lifetime ago. We had things happen, right? I know that here in British Columbia, we had there was a rugby or there was a dental convention, and that's where we saw a real spread. There was a dental convention or dentist convention here in Vancouver, and a bunch of people got COVID, and actually a local dentist, passed away from COVID. So that was like the real first thing that happened. There was also a rugby 7 game where a bunch of people were infected. I know that you point out in your book that, in the Skagit Valley choir outbreak was a turning point. So Skagit Valley is just to the south of us here in BC. And that was the whole thing. What was it? 52 out of 61 people got infected, despite our hand sanitizer and no hugging or kissing. So that should have been a clue, no?
yes, it should have been. And at the time, there were some experts who said, "Look, look at this outbreak with the Skagit Valley Corral in Washington State. Like, when you get this number of people infected in just, in a rehearsal that just took a couple hours, like, that really is the kind of thing you would expect from airborne infection." Um, but, the public health officials, they really didn't emphasize that when they were looking at that particular outbreak. They said, well, maybe people were, handling this doorknob to the restroom, or maybe they were, all reaching for snacks in the same bowl, and maybe it could have spread that way. And it's just, when people looked at it more closely later, they're like, no, this has to be airborne. And there were, as you say, there were case after case after case of explosive outbreaks taking place, when large groups of people got together in indoor spaces without a lot of ventilation. And, eventually it started to become really hard to ignore the evidence that it was airborne, but it took a while. It took quite a while.
I think there's still some people that don't think, today that because I mean, when I look at schools, to me, schools are a perfect example. A lot of classrooms don't have windows that open. They don't, I'll tell you, they're aging schools here for sure. And I don't think we're alone in that. So they don't have the ventilation systems that, you would maybe find in a government building or in, in these newer buildings, right?
Yeah, so we don't have yeah, so mandates for the kind of indoor air quality that would protect us from COVID, from measles, from influenza, and, who knows, the disease X, the next pandemic. Those kinds of mandates do not yet exist. They just don't. We've been through this COVID pandemic. We've learned that, the damage that an airborne disease can do. There still are not mandates in place. And part of it is because guess what? It will cost some money. I mean, you save a lot of money on the other end when people aren't getting sick, but there's just this reluctance to say like, "Okay, what do we do with a school where the windows don't open?" Well, I mean, there are things you can do. You can improve the HVAC system, and you can put filters in. You can put air purifiers in classrooms. They those all those things can help. In some situations, maybe ultraviolet light will actually be highly effective. There are lots of options. But if no one's requiring you to do it, then you just don't do it.
Well, but to me, like, that is a very, like, it's the pointy end of the stick. We know that if we breathe in clean air, we will be healthier. I mean, this isn't, this is, again, pretty common. This is common sense. I just interviewed a cancer researcher. He's a lung cancer researcher here in BC, Dr. Lamb, and he was the one who said we see way more lung cancer now because of pollution in our air and because of forest fires that are happening. And so we know that clean air can protect us from lots of things. Yet and to me that seems like low-hanging fruit, right? Like, we know this. I know it's expensive, but as you said, if we could, just look ahead a bit, we would see how much money it would actually save us in healthcare alone, right? Um, do you how do you feel about masks?
Well, in some situations, a high quality mask may be the best way to reduce the spread of diseases. Um, and the research and the reviews that have been coming out recently point to not just wearing a bandana over your mouth, but wearing a something like an N95 respirator. Just because scientists have done physical measurements and they can see that um, they just prevent viruses from coming into your mouth and they prevent viruses from escaping out of your mouth if you're sick. Um, are they a panacea? No, but if you can reduce transmission by 20, 30, 40% in a community, that's huge. And if you combine that with other ways of reducing transmission, that's really important. You know, I w you know, people do not s some people will not respond well to mask mandates because they feel like, "You're forcing me to put something on my face." I mean, and those are those are honestly, those are more cultural issues. I mean, Japan, for example, during the COVID pandemic, there was lots of masking. There was no mask mandate. It was just more of kind of a culturally accepted practice, and people just more readily were like, "Oh, we have a pandemic. It looks like it's airborne. Let's put on the masks." But that's separate from the science, and the science does. There's lots of lines of evidence that masks can definitely help.
Yeah, and they definitely help with pollution also.
Oh yeah, absolutely. For wildfires, yeah.
Exactly, and so it's so funny because, when you said a bandana won't work, I thought, "How much money did I waste on all these cloth masks when COVID first started," right? Because as you said, we didn't know, and we were getting information on our phones from all over the world. We were seeing what people were doing, and then people started selling these cloth masks, and, my daughter started making them. I actually wore one that she made out of, like, flimsy, like, how what it was when you look back now, you can go, "Oh my gosh, yeah, that I can't believe I wore that little mask. Oh, well, we learned," we learned along the way, I guess.
Well, it's not just that we learned. I mean, there was a reason why the United States government, for example, was once it decided to recommend masks, that it would tell people to make cloth masks because we were supposed to have stockpiles and production facilities for N95 respirators and other types of masks. And over the years, those things had been neglected. So our stockpiles were depleted and a lot of the supplies were old and so on. So we were, we were caught with our pants down. I mean, we should, the suddenly you had doctors and nurses who, were having to reuse N95s. Like that's the worst because like in hospitals where you have lots of sick people and they're breathing in and out, like that was one of the most dangerous places to be dealing with it, but we didn't have the supplies. So that was not just, oh well, we learned our lesson. That was a long-term um political failure.
Yeah. Well, I hope we fixed that. It was the same up here, by the way,
We haven't fixed it.
and I don't think we have either. I was saying that to be hopeful.
Sorry. Yeah, well, no, but it's like this message still we still have to pay attention to this message. There's a lot we still have to do. We know we can't say, "Oh, we don't know." We know. We understand that the danger that airborne diseases and other airborne kinds of threats pose to us. We know, and there are things that can be done.
I agree. I mean, I still wear a mask when I go on a plane. I'm there's not very many people like me who wear a mask the entire flight or, back. I wear it every time I go into a medical building because I feel like I know. So now I know and I can't unknow that stuff, right?
Yeah, so I carry around a carbon dioxide meter. Yeah, and it just gives you a readout. So I'm here with my window open at home, and it says 476 parts per million, which is basically outdoor level, very healthy. If you get on a plane and they close the doors and they haven't started the ventilation system yet, they don't start it until you've taken off. That level will easily go up over 1,000, maybe over 2,000, which is telling you that other people are exhaling their carbon dioxide into the cabin, and it's not going anywhere. And so you are inhaling what they're exhaling. And if they're exhaling COVID, tuberculosis, measles, a whole range of other airborne diseases, you are inhaling those too. And it's so so I put on a mask as well in those situations.
I do too. I just feel I don't want to go somewhere. I always say to people when they're like, "Why are you wearing a mask?" I'm like, "Do I want to get to the other side of my trip and be sick?" No, I don't. So it's just easy to wear a mask. No problem. One of the things we do, Carl, is we like to thank our guests for being here. We asked them to choose a Canadian registered charity. You chose Nature Conservancy Canada, and we are going to make a donation in your name as a thank you for you being here. Thank you so much for choosing them. So, as we wrap up your book, I hope people get your book and understand a little bit more about airborne, the hidden history of the life we breathe, because you really do go into the history of it all. And one of the things you mentioned this earlier was, and I've never heard this word before, aerobiology. So Fred, is it Meyer? Is that how you say his last name? Fred Meyer was the watermelon doctor. What does that mean?
Fred Meyer was a plant pathologist. He studied plant diseases, and uh, in uh, in the early 1900s, when he was just starting out, he discovered a disease, an airborne disease of watermelons called watermelon stem rot. It was a fungus that would move around from one watermelon field to another and kill watermelons, and that got him thinking about the life in the air and the threat that it could pose to our food supply, not just watermelon, but wheat, coffee, all that. Basically, everything we grow is at risk of getting attacked by diseases, many of which come through the air. And so he then wondered, well, how high, how far do these things go? Like, what is the global picture of all this life in the air? And so in the early 1930s, he went on this incredible set of expeditions in airplanes up in the clouds, waving petri dishes around, trying to catch stuff. And he did. And he, caught spores and other things. And then he enlisted Charles Lindbergh to help him. And then, when people explorers were gonna go up into the stratosphere in a balloon, they took probes with them to capture stuff for Fred Meyer. And so Fred Meyer in 1937, he was trying to organize the few scientists who were studying this stuff, to work together and to set up a government research center in the United States. And he said, "We have created a new science here. It's called aerobiology." And so that's what we still call
It's they should make a movie of him.
it. He's
It's
amazing.
such a good story, right? It's like, well, it's a true story, and it's just like it's changed everything for us. So tell us a little bit about William Firth Wells and Mildred Weeks.
Right. So Mildred Weeks was trained as a medical doctor in the early 1900s in Texas, and then she came to Washington, where she met William Wells, and they got married. He was a sanitarian. In other words, he was monitoring the health of and safety of water in rivers and so on, because there was lots of pollution from bacteria and so on. And the two of them later on in life would go on to do pioneering experiments and develop ideas about how diseases can spread from person to person through the air. So while Fred Meyer was looking at the big picture of life in the atmosphere all the way to the stratosphere, the Welleses were just looking on that, closer scale, person to person. And, they developed a lot of the key ideas about how is it that, if I have a disease like, say, measles, how is it that I can infect someone who's 20 or 30 feet away? Well, it turns out like as I'm speaking and breathing, I'm releasing tiny droplets. I don't have to sneeze. You're constantly releasing tiny droplets. Some of them have germs in them. And if you happen to be sick with some disease that makes people sick, well, those droplets can carry it along. So they had we owe a huge debt to them, but unfortunately, Mildred and William Wells were um, by the time Mildred died in 1957 and William died in 1963, they were pretty much lost to obscurity. It's really quite tragic.
Right. People don't remember who they are and their role in what we know today. Richard Riley, he took up the tuberculosis research, did he?
Yeah, so Richard Riley was actually an assistant to the Welleses in the 1930s when they were at Harvard, and Richard Riley was a medical student. They parted ways, and Richard Riley went off and had a great career studying a lot of things about how we breathe and sort of the physics of that. A lot of important research helping with lung disorders. And then in the 1950s, William Wells is really desperate. He's pretty old now. He's approaching 70, and he wants to prove that tuberculosis is airborne, like just one last shot at trying to persuade people. And Richard Riley, who's now Johns Hopkins, says like, "Yeah, I'll work with you on this." And basically, they come up with this incredible experiment that takes place at a hospital where they do demonstrate that the patients with tuberculosis were exhaling bacteria that could then cause infections. And they did it. I mean, and that is the key experiment that finally got people to accept that at least tuberculosis is airborne. William Wells had hoped that that would actually like get people to think about airborne diseases more generally. Unfortunately, people said, okay, tuberculosis, yeah, that's fine, but nothing else. And that was tragic.
And so by the time the CDC acknowledged that tuberculosis was airborne, most of these scientists were gone by then. They had passed away by then, so they never even got to see this.
Yeah, William Wells died in 1963, and then Richard Riley continued to try to, spread the word, particularly about tuberculosis, into the 60s, the 70s, and he retired in the 1980s. And, just a few people really paid attention to what he was saying. And yeah, so he died at a very old age in 2000, but really, he did not get to see it would be quite something if he had been able to see the way that airborne infection is now recognized as being so important now.
Yeah, it's incredible. It's such a deep history that most of us aren't aware of, and your book does such a great job or your work does such a good job of you laying it all out for us so we understand better. And there's always more to learn, isn't there, Carl?
Oh, absolutely.
There's always more to learn. Are you already thinking about your next book?
I like to let books come to me.
I love it. Okay, hold up your book one more time. It's called Airborne: The Hidden History of the Life We Breathe. Thank you so much, Carl. You can find Carl on his website at carlzimmer.com. That's Carl with a C. And you can find his book wherever you buy your favorite books. Carl, it's been a pleasure. Thank you so much.
Thanks a lot. It's been real fun.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.